Welcome to Improving Health Through Exercise. Our learning objectives for this presentation are that after participating, you should be able to explain the physical benefits of exercise, the mental health benefits of exercise, how much exercise is enough, how to get started, local resources to support your efforts, and a few simple chair exercises. 6 in 10 Americans live with at least one chronic disease, such as heart disease, stroke, cancer, or diabetes. These and other chronic diseases are the leading causes of death and disability in America. But regular physical activity helps improve overall health, fitness, and quality of life. It also helps reduce your risk of chronic conditions such as obesity, type 2 diabetes, heart disease, many types of cancer, depression and anxiety, and dementia. The information provided in this program is taken from the American College of Sports Medicine. They believe that exercise is medicine. The physical benefits of exercise, both strength and endurance, has a positive effect on most systems in your body, including your circulatory system, which is the system of blood vessels. It improves aerobic capacity, so the ability of your blood to carry oxygen to the tissues in your body. It improves blood flow to muscles. It may reduce your blood pressure and may reduce your resting heart rate. Benefits for the respiratory system include improved oxygen consumption, so you can breathe more deeply, reduces risk or helps manage pulmonary or lung conditions by improving breathing efficiency and reducing how fast you are breathing. It improves flexibility and strength, reduces the risk of falls, and increases bone density. Physical activity also improves cholesterol by decreasing the LDL, increasing HDL, and decreasing triglycerides. Physical activity stabilizes blood glucose or sugar levels and improves glucose tolerance. Mental benefits of exercise: it improves your mood and energy, increases hormones called endorphins, which make you feel good and positive, improves happiness and overall life satisfaction, self-esteem, boosts confidence and self-efficacy, reduces stress, helps your body ability to cope with stress, and decreases symptoms associated with depression, as well as improving your sleep. So how much physical activity do I need? Basically, move more, sit less. The American Heart Association has conducted studies that found that 150 minutes of physical activity each week will result in improvements in your overall physical health. We never want to induce shame or guilt about not currently participating in physical activity. We don't want to encourage an unsustainable exercise or diet program that results in depriving or restricting yourself from what you want to enjoy in life. And you don't want to be exercising so much that you're abandoning self-care. Slow and steady wins the race. Think about where you are right now with your physical activity and make a plan to slowly do more. Ask your provider for a referral to a physical therapist for strength and endurance training. You may have set a goal to eventually attain 150 minutes a week of moderate intensity aerobic activity. This is anything that gets your heart beating faster and perhaps makes it a little more difficult to carry on a conversation while you are exercising. You also want to do muscle strengthening activity, so activities that make your muscles work harder than usual. And you'll want to do that at least 2 days a week. Tight on time or not currently doing any physical activity at all? Start with just 5 minutes. You will slowly build strength and endurance, and it all adds up. Research shows it's just as effective to do 3 10-minute periods of exercise spread out over the day than 30 minutes all at once. And that comes from Johns Hopkins. Cardio or aerobic activity includes activities of moderate or vigorous intensity. They get you breathing harder and your heart beating faster. Examples of these activities are walking, biking, dancing, or yard work. Muscle strengthening works best when you work all your body's major muscle groups, including the legs, hips, back, chest, abdominal muscles, shoulders, and arms. Examples include heavy gardening or carrying heavy loads, including groceries. More examples of moderate intensity aerobic activities include brisk walking, water aerobics, dancing, gardening, tennis or pickleball, biking slower than 10 miles per hour. Vigorous intensity activities include hiking uphill, running, swimming laps, aerobic dancing, heavy yard work, tennis, cycling 10 miles per hour or faster, or jumping rope. How do you know if it's moderate or vigorous? You can use the talk test to find out. When you're being active, just try talking. If you're breathing hard but can still have a conversation easily, that would be moderate intensity activity. If you can only say a few words before you have to take a breath, it's likely vigorous intensity activity. You may also use the target heart rate zone. You take the number 220 minus your age, which is the age predicted max heart rate. Here's an example, 220 minus 60. So for a 60-year-old, 160 is a max heart rate. Light intensity would be between 40 and 60% of the max heart rate, or 64 to 96 beats per minute. Moderate intensity activity would be 60 to 80% of the max heart rate, or 96 to 128 beats per minute. Tips to get and stay active. First, talk to your provider if you have a chronic condition. You may want to ask for a referral to physical therapy for strength and endurance training. Get the support of your family and friends and invite them to get active with you. Start slowly and slowly add time, frequency, or intensity to your activity every week. Schedule physical activity for times in the day or the week when you're most energetic. Plan ahead. Make physical activity part of your daily or weekly schedule. Walk instead of drive to nearby destinations, or park the car farther away and fit in a walk to your destination. Support improvements in your neighborhood that make it easier to walk or bike where you want to go. Do strength training. That is key for maintaining strength and preventing muscle atrophy as we age. Get an exercise partner. Work out with a friend or a spouse. You generally tend to exercise more because you have that person to encourage you. Even owning a dog will help to get you out and walking. Be sure to stretch regularly to maintain flexibility. Stretching can counter the aging tendency to be less elastic and help prevent injury. Don't start exercising without your provider's blessing. Be sure to ask your healthcare provider if you have any underlying health risks, such as chronic disease. Start slow and progress gradually. Don't sign up for an expensive gym. You can start exercising right in your own home. Even something as simple as walking to get to the mailbox rather than getting your mail as you drive up. Don't focus on cardio alone. You want to be sure to include strength training as well. Local resources for physical activity include using the Snoqualmie Valley Trail for walks or bike rides, joining Snow Valley Senior Center or the Mount Si Senior Center. The Fall City Masonic Lodge offers jazzercise. There is a YMCA in Snoqualmie. There is a community center. Skyview Community Center has various activities, and oftentimes local churches provide activities throughout the week. Here are some resources for you to find additional information. And if you are a patient at CarePoint Clinic, there is a physical therapist available to teach you how to do some simple chair exercises.